The copper metabolism and disorder presented by the SchrDbb. We reference chemical pathology lecture notes of University of Cape Town. So here we're going to visualize copper metabolism first. So in copper metabolism, you need to know that generally copper can be converted from copper 1 ion to copper 2 ion. To be converted from copper 1 ion to copper 2 ion, there is a release of 1 electron, and this process is called oxidation. While the other way around, from copper 2 ion to copper 1 ion, is going to be reduction, because it's gain of electron. Now you need to know that while approximately 5 milligrams of copper is going to be consumed per day, and the copper is absorbed through small intestine, where it's going to be complex with albumin for it to be transported. Is it clear? And with amino acids, and copper mostly the most important amino acid that transport copper is histidine. Is it clear? And also in blood is also going to be transported by the major protein, which is called celluloplasmine. Celluloplasmine is a major protein that transports copper. So any excess of copper is not used and is secreted in the bile and released in feces. So what are examples of copper containing enzymes? So here you also have copper which are bound to certain enzymes and certain proteins. So example, you have celluloplasmine. The function is a peroxidase. So deficiency of celluloplasmine, you have diabetes, you have retinal and basal ganglia degeneration. You have also copper and zinc superoxide dismutase. It causes disproportion of superoxide anion. You have cytochrome C oxidase, which results into this and then the different diseases. Now celluloplasmine is an alpha 2, so it's another major important protein that binds to copper. It's an alpha 2 glycoprotein which contains 95% of plasma copper. It is a peroxidase involved with ion metabolism and does not exchange copper with that in the serum. So it does not involve, so it involved with ion metabolism. It means that what it is an enzyme. Celluloplasmine actually is an enzyme which is involved with ion metabolism, conversion from ion 3 ion to ion 2 ion. Is it clear? So it's actually that form of peroxidase in ion metabolism. But it's the copper, it is not actually transporting copper, but the copper acts as a cofactor for the functioning of this celluloplasmine, for the conversion of ion 3 ion to ion 2 ion. So it is a single polypeptide with the 6 atoms. Celluloplasmine occur with copper bound as a form as a halo celluloplasmine, and a copper free form as a apocelluloplasmine. Is it clear? Now the copper content in the liver determine the ratio of the apo and the halo celluloplasmine. Now we have disease of copper metabolism. Is example of disease is going to be Wilson's disease. Wilson's disease, also called hepatolenticular degeneration, where you have degeneration of both of the liver, and you have the degeneration of the lenticles, of the lenses of the eye. Is it clear? So it's characterized by copper overload in the tissue of the body because of lack of celluloplasmine. Now it mainly involves one, liver cirrhosis, and sometimes fulminant form of hepatitis. In the brain, you are going to have neurologic signs, especially abnormal movement at the basal ganglia, because you also have basal ganglia degeneration. Because we've seen just up here that there were different the deficiency of celluloplasmine is going to result to this different disease, and we have forgotten to say Wilson's disease, which is a characteristic of both retinal and basal ganglia degeneration, and you also have diabetes with celluloplasmine deficiency, and these are other deficiencies that you can have and the different disease that you can have, which I'm not going to speak about. Now the cornea, the level of the cornea, you have what is called Kaiser Fleischer, which are bluish green pigmentation at the level of the eye. At the level of the kidney, you have renal tubular dysfunction. So Wilson's disease is an autosomal recessive inheritance. It's caused by a defect in the Wilson ATPase copper ion pump. This pump, which is exclusively found in the liver, it's going to pump copper from the cytoplasm into the endoplasmic reticulum. So it's going to be incorporated as copper proteins like celluloplasmine, or targeting the bile and all that. So it's going to be actually, you can also consider it as a low level of celluloplasmine that is going to result to excess accumulation of copper in the different part of the body, because celluloplasmine can help to remove copper from the different part of the body. The two main parts of the body that are affected are the lenses and the hepatic and the liver. So it's called a hepatolenticular degeneration. So the biochemical finding here is that you have a total plasma copper is going to be decreased because it does not bind again to celluloplasmine. You have decreased plasma celluloplasmine. You have increased urinary copper, reflecting that there is increased free copper in the plasma, because normally celluloplasmine is containing copper. And the gold standard diagnosis is by liver biopsy, where you see copper in tissues. Now, the treatment. How do you treat patients here? You do dietary restriction of copper. Is equal not liver, chocolate, shellfish are high in copper. You have chelation. You can use penicillamine is the best drug which is used for the chelation of copper. Is equal, and you can also use triethylene trimine dihydrochloride. That's also called trientine. They can use also in the chelation of copper. Zinc induces metallothionein within erythrocyte, and thus also causes intracellular chelation of copper. You can use also zinc for intracellular chelation of copper, because zinc induces a protein called metallothionein in order for it to be chelated inside the cells. Liver transplantation is curative for the liver diseases and may also resolve the neurologic and psychiatric symptoms. Now, the next metabolic disease with copper is Meng's disease. So Meng's disease is an X-linked copper-related inherited disorder which causing copper deficiency. The disease affects the kidney, the placenta, the brain, the gut, and the vascular system. So disease presents between 1 and 3 months of life. So here we are going to have neurologically, there's mental retardation, seizures, truncal hypotonia, and loss of developmental milestone. In the connective tissue, we have soft bones and cartilage abnormality, weakened artery wall, and you have abnormal sparse kinking of hairs. Now, the disease is caused by mutation of the Meng ATPase copper 2 pump, while in the case of Wilson's disease was a disorder affecting the Wilson's ATPase copper 2 plus pump. Here is the Meng's ATPase copper 2 plus pump. So this pump, which is found in the non-hepatic tissue, has some function as the Wilson ATPase copper to transport copper. So here this patient is also not going to have also copper, is to transport copper. Is it clear? Is going to have excess accumulation of copper inside the tissue. Is it clear? But in this case, though he has excess accumulation of copper inside the tissue, he is not going to also, he's going to have also excess accumulation of copper. He is also going to have deficiency of copper. Is it clear? So when the copper arrives at the intestine and the placenta, it is absorbed, cannot be exported out of the cell. Is it clear? So what are the findings here? So the finding is low serum copper, low serum celluloplasmine. Unfortunately, these findings are not helpful as early infancy. Is it clear? And the characteristic pilotorti hair, twisted hair can also be seen. Can be seen at few months of life for specific Meng's disease. The gold standard diagnosis is still to visualize copper accumulation in cultured fibroblasts. So in order to treat here, you use parenteral copper preparation. Is it clear? Because this patient have copper deficiency. The symptoms of copper deficiency occur in this patient, unlike copper accumulation which occur in Wilson's disease. So in this patient, you have copper deficiency. You are going to use parenteral copper preparation such as copper histidine in order to reduce the symptoms. As we have seen just above here, the biochemical finding of copper deficiency is going to be accumulation of copper at the level of, you have accumulation of copper at the level of the plasma, and you have accumulation of copper at the level of the tissues. Is it clear? So you need to use penicillamine in order to chelate the copper, because there's excess copper in Wilson's disease. But in Meng's disease, there is instead deficiency in copper. Is it clear? So you need to treat it by giving copper to the patients. So from here we are finished with all the metabolic disease of copper. And we say thanks for your kind attention. Please don't forget to like and subscribe for our channel, Science Video Maker. Thank you.